Let's open up some journals, magazines, publications that Americans read every day to learn about health, to see if these articles have any evidence, data behind the claims that they make, as opposed to just providing opinions. Dr. Oz, The Good Life. Let's see what's inside this magazine. So here's an article about multivitamins, everything you want to know about multivitamins. And there's a lot of claims on this page. One of the claims is that you need more B12 as you age. Another claim is that women need less iron as they age, and another claim is that you need more calcium as you age. But as you can see, that it's all words and some numbers regarding age, but there's no data, there's no evidence behind that claim.
A survey of approximately 7,000 patients in the U.S. population showed that less than 1% were diagnosed with a vitamin B12 deficiency, requiring B12 supplements. The rate for this level of B12 deficiency in the elderly is around 3 to 5%. Another study of 421 patients with vascular disease showed that B12 deficiency can be as high as 17%. A review of over 300,000 persons in North America showed that 8% of women, 5% of men, and 7% of children have iron deficiency anemia, which causes approximately 5,000 deaths a year.
I see a claim right here that says some experts suggest taking statins if your risk is above 7.5%. And as you can see from the article, there's no data, there's no evidence proving that statins are effective at preventing heart attacks, stroke, or death.
In 17,802 patients, 0.2% with no cardiac risk factors and normal cholesterol levels that took Crestor had a heart attack at almost 2 years of follow-up, whereas 0.7% of these patients that took a sugar pill, no Crestor, had a heart attack. The difference was 0.5%.
Here's Women's Health with Heidi Klum on the cover, evidence that she's beautiful. Here's a magazine called Muscle Fitness. Here's an interesting ad about growth factor 9. What does 682% better mean? Did it go from a low level to a high level? Did it go to a level that could be considered dangerous? What is the evidence that having an elevated growth hormone level is safe? What if it's associated with cancer or other diseases? And what is the evidence that growth hormone even has positive benefits like increasing muscle mass or anything else like that?
No studies have been done yet that have determined the risk of cancer in patients who take growth hormone supplements. The administration of human growth hormones for 6 months in 21 healthy men, ages 61 to 81, showed that there was an 8.8% increase in lean body mass, a 14.4% decrease in adipose tissue mass, and a 1.6% increase in average lumbar vertebral bone density. Skin thickness increased 7.1%.
All these magazines are fun to look at, easy to read, but what you're not going to find in these magazines is evidence or data proving whether or not the claims they make are reliable and accurate. I say we put them back.
Oh, I'll take that.
Needs evidence.